It's a disease that's often overlooked by men. Osteoporosis weakens bones, causing them to be brittle and to break easier. And the condition does not discriminate based on gender. In today's Health Minute, Mandy Gaither explains why men should also focus on bone health.
At 40 years old, Brad Barbin was prescribed steroids for a condition. Because of that medication, he was told his bone health was at risk, something he'd never thought about before.
I had played football and rugby after college, and so never really worried about breaking bones until somebody says, yours are at risk for fractures, if not worse.
Because of that, Barbin says he started walking 3 to 5 miles a day to help maintain bone strength. Regular exercise and resistance training can help prevent osteoporosis, says Dr. Paul Lewis with the Ohio State University Wexner Medical Center.
Exercise is medicine.
Lewis says some in the U.S. don't see bone density as a top health concern, but it can significantly impact a person's life, especially as they age.
If you have the diagnosis of osteoporosis, you're 4.5 times increased risk of a spinal fracture. And men particularly, they have more complications and more poor outcomes after an osteoporotic fracture than women.
Now at age 68, Barbin says he feels great and encourages all men to focus on bone health.
The best thing you can do is do your annual checkup. Listen to them when they tell you you need to take a bone density test. Just do it, and you have a much better idea of what your next 10 years are going to look like.
For Health Minute, I'm Mandy Gaither.
Now, the U.S. Preventive Services Task Force recommends osteoporosis screening for women aged 65 and older and for younger postmenopausal women with increased fracture risk. For men, though, the task force says it's found insufficient evidence to recommend for or against screening. However, other organizations recommend screening for men aged 70 and older or younger men with risk factors. So experts say to talk to your doctor about the best path for you.